Hello, my name's Amanda Smith and this is Rita Smith and we're filming the week 3 health assessment video. So health history, can you describe how you feel your health has been for the past year?
I think my health has been good, steady.
Okay. And for the past 5 years?
I think in the past 5 years, I think I actually got a little healthier. It was a little more time to exercise.
Okay. And are you concerned, and what are you concerned about regarding your current state of health?
Just that I guess I've been extra busy lately and haven't had time to exercise like I should.
Okay. Do you have any plans to get back into exercising like you feel you should?
Yes, I have a few things on my agenda to take care of, and then I hope to get back to where I was.
Okay, good. And what diseases or conditions are most prevalent on your mother's side?
My mother's side is breast cancer.
Okay. And are you doing like mammograms every year?
Started mammograms very early. I think I was 35.
Okay.
And I do the 3D mammograms because they are a better test for breast cancer.
Right. Okay. And what diseases and conditions are most prevalent on your father's side?
He had stomach cancer. My father and my grandfather both died of stomach cancer.
Okay. Any tests for that or just regular visits to your primary care physician?
As far as I know, I don't think there's any extra tests or screenings for stomach cancer.
Mm-hmm. How often do you feel you follow the recommended food pyramid?
About every day. I think I eat healthy.
Okay. And how often do you eat fast food?
Never.
Never?
Nope.
Okay. How many days a week do you eat in and cook fresh meals?
I would say 6 days a week.
Okay, good. And what medications are you currently taking?
Zoloft.
Zoloft. Okay. Can you please describe any past surgical history? What was done and when you had the surgery?
I have tubes in my ears to help with drainage, and I had Guyon's canal surgery and carpal tunnel surgery.
Okay.
On my breast.
And what led to the tube in the ear?
Hereditary, have bad ears and don't have proper drainage.
And the carpal tunnel?
They don't know why it did that. He said I have abnormal looking vessels though in my wrist, so it may have something to do with it.
Okay. But you weren't like were you having like pain in the wrist?
Yeah, that's how I started going, pain and tingling, numbness.
Okay.
Weakness.
And how active are you, or how many hours of activity do you get per day?
I feel like I'm active, very active for my age group. And when I'm not working, I probably get 3 hours activity a day. When I'm working, I'm mostly sedentary because I have a desk job.
Right. What kinds of activities do you usually do?
Walking, I enjoy bike riding and horseback riding.
How many hours of sleep do you typically get?
Usually 8 hours, 8 to 9.
Do you feel well rested?
Not lately.
Not lately?
Yeah.
Can you tell me why?
Because we are in the process of building a house and I have a lot on my mind, so I'm not getting the rest I need.
Right. Is there anything that you feel would help you get more sleep? Any like relaxation techniques that you are trying before sleep?
No, to be honest. I know I need it, but
Right. We can go through some of those. So what barriers or what complaints do you have any complaints for your cardiovascular system?
not really complaints, but I wish I could exercise more to get in better shape. I could feel within the last 6 months of not exercising the difference.
You get like winded
Yes.
easier?
Mhm.
Okay. And what about for any complaints about your skin?
Just that my skin seems, as I've gotten older, more sensitive to detergents and clothing.
Oh, okay. So you use the same detergent or try to use the same detergent?
Yes, I have to. I switched once and it was a mess.
Right.
And ear, nose, and throats have very bad ears.
Very bad ears.
Mhm.
Okay. And did you have surgery on your eyes?
I had LASIK surgery years ago.
Surgery?
Mhm.
Okay. And what about your immune, musculoskeletal system, anything like that?
I think that's all going good.
Yeah. Nervous system, digestive system?
My digestive system is a little off because I'm not eating as well as I should.
Right. Is that because of you're stressed about building the house?
Exactly.
Alright, so what kind of social activities do you prefer and how often do you get to do them, would you say?
I like to horseback ride, but even that, I've not been able to do that because there doesn't seem to be enough time lately.
Mm-hmm.
And I was doing yoga for a little bit since many of my friends suggested it for me, but that's another thing I just don't have time for right now.
Do you think it would be a better idea to work in time for those two things to make you de-stress a little bit more? Like you should make that a little bit of a priority?
I just can't right now. It's more stressful to try to find more time in the day.
Right. Alright, can you explain any barriers that you would have that would prevent you from seeking treatment for anything or medications? Any economic?
No.
Okay, that's good. And what ethnicity do you most identify with, or culture? And are there any cultural barriers that we should know about?
No.
No. What religion do you identify with?
I would say most would be Methodist.
And where do you live?
In Middletown, Delaware.
Okay. And what type of area is that? Suburban?
Suburban. Rural.
Do you have any environmental concerns for the area that you live in?
Not the particular area, but I don't think Delaware has a very good reputation for quality. Yeah. Quality of air and a lot of cancer.
Because of the factories.
I assume.
Where and when did you last attend school?
I went to Cecil Community College for a certificate program in medical coding.
And where are you currently employed? What's your profession?
Medical coder, and I work for Questionnaire.
Do you have any plans for continuing your education or any other certifications that you'd like to get?
Not right now. Maybe get different certifications in the same field, but I enjoy what I do.
Okay, that's good. Is there anything else that you'd like to discuss?
Not this time that I can think of.
Okay. That's been the week 3 health assessment video.